So let's dive back into learning about Clubfoot. Okay.
Mm-hmm.
So how you say you work with the family for rehabilitation and other things, since nobody knows what causes that
Yeah.
condition. Okay.
Mm-hmm.
So tell us uh, what program do you uh, recommend for families with the child with clubfoot?
So Clubfoot care and management really is a joint effort. It is successful if implemented by a multidisciplinary team. So the
Mm.
diagnosis is clinical. It's only when the baby is born. It's only
Yeah.
when the baby is born you see it. Of course, you can see it in utero, like when the mother is pregnant, you can also see it by radiology. So sometimes it's good if the mother can afford it, if the mother goes to antenatal and was able to see it. There's nothing that can be done, but it just prepares her mind and it prepares the mind of the clinician that this is what we're expecting. So when the baby is born, immediately the baby is born, the treatment starts. We use a non-surgical. We promote in Miracle Fit. Miracle Fit Partners promotes the use of a non-surgical method called
Yeah.
the Ponseti method. The Ponseti method. Over many years, surgery has been the gold standard, but it has been known that surgery comes with many complications and what we call relapse. So it will
Mm.
seem as if it's been treated, but then over 5 or 6 years, you see that it was not well treated. So
Yeah.
now we are using Ponseti method, which involves the normal POP, the POP
Yeah.
that white
Mm-hmm. Mm-hmm.
bandage that when you
Yeah.
soak it in water, you wrap it, and when it sets, it gets
Hardens.
strong. That is what we
Yes.
use. Exactly. The team of doctors, the team of physiotherapists and nurses use it to gently manipulate the foot. There are some criteria, there are indices. They first of all inspect the foot, the affected foot. Some babies have it on both feet. They will inspect it. There's a scoring system called the Pirani score, and then they start the manipulation. They put the POP around the entire leg, and the baby comes every week to review and to recast, to
Yeah.
put in another cast. After 5 or 6 weeks, that's after 5 or 6 visits, they are given what we call a brace. It's a specialized shoe that they are required to wear over 2 to 3 years. I think in the first 6 months, they wear it for 23 hours. Sometimes it's tedious.
Wow.
The baby is uncomfortable.
Yeah.
But
Mm-hmm.
after like a month, that the woman I met yesterday, I spoke with yesterday, she said after a month, her son got used to it
To it.
and there
Yeah.
was no issue, because it's very important that this is where the psychosocial counselors come in. This is where the nurses come in. They keep talking to the parents, especially the mother, because let's be honest, it's the mother that usually bears the brunt of it. It's the mother that
Yeah.
comes to the clinic more often. It's the mother that sleeps with the baby more often. So they keep encouraging the mother not to give up, that compliance is key, and
Yeah.
that once you're able to scale through this phase, your baby's feet will be solidified and will be corrected in the
Yeah.
right way. So that's
Yeah.
what the treatment option is. So Miracle Fit and its partners, we have many programs. We have parental educational trainings where only parents are gather. Sometimes they share their experiences. Imagine someone that has been in the program for 1 year is talking to someone that just joined the program this week.
Yeah.
The
Mm-hmm.
person will be more encouraged, because this is someone speaking from experience. This is what the treatment looks like. Oh, this is what you should do to succeed. Even when your baby is crying and cannot sleep at night, don't worry. After 2 weeks or after 3 weeks, everything will be fine. So we have such programs. Then we also have a program we call early detection and referral training. This is for health workers, for midwives, for nurses, for other nurses in other sections of the hospital that are not in pediatrics. If you're in obstetrics and gynecology and pediatrics, that's the team that catches the
Yeah.
baby.
That catches.
You must have
Yeah.
an obstetrician, and then you must have a pediatrician. However, there are other people in even pharmacists. Just imagine this scenario. A mother comes to the hospital for something else. The doctor has seen her, then she goes to the pharmacy to take her medications, and she's
Yeah.
carrying a baby with clubfoot, and she never knew that this condition is treated in this hospital. If any staff in that hospital has been trained to identify clubfoot in any of their units,
Yeah.
the woman, there's a high chance that
Somebody
baby
will catch it.
someone will catch it.
Yeah.
So we have early detection and training for health workers. Right now, we are even trying to include like traditional birth attendants. Those ones are in the communities. So we've modified the curriculum because they will not understand. They will not understand. They are not trained. They are not skilled. They will not understand some keywords. So we've modified it for the community aspect where this TB is, because whether we like it or not, the traditional birth attendants are still receiving babies. People are still giving birth at home, in the bush, in the market. So we also need to sensitize those ones. We also have programs for traditional rulers, and that is high level advocacy. We have meetings. Our partners have meetings with traditional rulers, religious leaders, to convince people, because sometimes when the Clubfoot baby shows up, they say it's witchcraft, or someone went to the river to get a baby. We've heard all sorts. We've seen men that divorced. They are not the when you talk about divorce, it sounds prestigious or whatever. Men have chased their wives away because their babies came out with Clubfoot, but it's nobody's fault. So we have such educative and sensitization programs to tell everybody that Clubfoot is treatable, it is treatable, and it's free, and it is not witchcraft, and it is not due to whatever the woman did or did not do. So those are it keeps us busy. We have so many other things, and maybe during the course of the interview, I will speak more about it.
Yeah. Wow.